What do you see specifically as the ways in which children's advocacy centers and other child abuse professionals who may be on multidisciplinary teams can be most helpful with this vulnerable population?
So glad you asked, because I just hope this sparks some more ideas. These are only mine and it's only the beginning, but I'm thinking there are things that we can do. So, for example, a lot of these kids have been exposed to sexual violence, sexual assault, sexual abuse in their home country, sexual assault on the way here, gang violence, other physical abuse, tons of community violence. So they're terribly traumatized, but all of this has happened outside the country. So when they get here, the police are not necessarily going to get involved because these are crimes that happen somewhere else. So in general, a lot of CACs will say, well, we get our referrals from law enforcement and child protective services, so these kids are kind of left out. So what I think we could do is say, by God, these kids need us as much as anybody else does. What can we do to provide services to address some of that historical trauma that may be only 2 months old by the time they get to their sponsor city, which could be anywhere in the United States?
Yes.
They need the offer of mental health services, and in some cases they need a good forensic exam because they haven't had one.
Yes.
They need support for all of these things that admittedly did not happen in the United States, but that doesn't matter. It's still traumatizing. So I think that if child advocacy centers could say, okay, we have to figure out how this is going to work. We got to make this work because these kids need us. And if we could also be aware of community resources. So for example, if you're a CAC in New Jersey, let's say, and you have a family sponsor who has a child and they come to you and they say, well, my child speaks Spanish. Maybe you don't have a Spanish counselor, but at least the child advocacy centers could say, well, we know of all the resources around us and we can plug you into this refugee center and that mental health center. And that, so you could sort of act as liaisons to help guide sponsors to get their children services. It's overwhelming if you think about it. You're a sponsor of a child, you may be undocumented yourself, you may not have a good command of the English language. And so suddenly you get this child with a list of, oh, by the way, if you want to, hook up with some resources, here's a list. They're overwhelmed with that.
They're never going to get to that list. And even someone who's not from another country is not going to ever get there based on a list, right? So,
but if they could somehow make it to the CAC and we could then say, okay, let's sit down. What can we do for you?